Welcome to our summer program. We are going to go over a few things that you briefly missed at our teen orientation. So please pick up your packet in our office and return the quiz as well as the confirmation information sheet on your first day of service. You can come in and pick that packet up prior to this if you would prefer to get those tasks done prior to coming for the first day of your service. Please realize I'm not always in the office, so your information packet will actually be on the kitchen table where you actually sign in and sign out in the volunteer office. It will have your name and everything you need in your packet. First, you will need to go to Human Resources. This is located on the 4th floor in the West Wing to have your ID badge made. They have your name. Just explain who you are and why you're there. Second, in your packet, along with the information that we'll discuss today, is your t-shirt, the size you requested. Please review all of those papers, take the quiz, and leave the papers requested prior to reporting to your shift. The sign in and sign out for your hours of service. You must sign in our office, preferably. If you're off-site, you can see how to actually sign in and sign out when not on campus. You need to know that this year we're doing a little differently. We want you to sign in as soon as you report for your volunteer services, and then when you're done on your unit. We used to include your meal times in your total hours, and we're not doing that this year. So meal time is not included in your service hours. Speaking of that, one of the benefits that we have for our teens who are here is that for every 4 hours that you give up service, we actually provide a meal for you. So that includes for you to go through the cafeteria. You can use your badge. They will charge that to our department. What we ask is that you get no bottled drinks like the Starbucks, the Gatorades, the bottled sodas. All of those items, bottled water, all of those items actually come in fountain format, and so we request that you not get those in bottle format. Please be a good steward and not bring your friends along and pay for their lunch, as well as not getting more food than you can actually consume. So that's being a good steward and using our values of not being wasteful. If for some reason you forget to punch in or punch out, we also have time edit sheets that are located by the computer here in our office, and you'll be sure to sign those forms so that we can edit your time. During the day, our office is normally open so that you can just come right in, even though that there is a lock or a security code that's on that door. If you are here early or late or on the weekends, when that door is not just easily opened, the code for the door is 1245. That allows you to access and sign in to our computer here and have access to this office area, even if I'm not here or the volunteer office is officially closed. Included in your packet is a printout. It looks similar to this, and that printout is actually your assignment. It tells the duties, the qualifications, but most importantly, it tells your coordinator's name and contact information. This is important for you to have in case there's an emergency and you're not able to report to the unit, that you need to notify them and let them know that you're not coming. The other important thing is that on the first day that you report, please verify that that's the number you should be calling. You may in fact have the director or the clinical manager who is not the person on a daily basis that would let somebody know that you're not there because they are in and out of their unit. So verify that that's the number you should be calling if in fact you had to call off in a short notice. Otherwise, if it is time that you are scheduled that you know you're going to be off, or you know you're going to be on vacation, that should have already been set when you did your self-scheduling, and they have that already on record. But please make them aware maybe that you're not going to be there the second week of July because you have vacation. And just, again, when you leave the week before, say, remember, I'm not going to be here next week. It's all about communication and letting them know. Speaking of vacation, our expectation is that you have 4-hour shifts, 6 of them, and so therefore you have a minimum of 24 hours. You can now, at this point, schedule those makeup times, but please have that discussion prior to just putting yourself on the schedule, and ask the department when would be best, or if it's okay if you go ahead and schedule a makeup shift. Again, it's communication. All of your coordinators will be getting email as soon as you put yourself on or take yourself off the schedule. So again, you want to kind of look it over, be sure that is the time, and not change your mind multiple times because they get multiple emails. When arriving on your first day, if I'm not in the office, to show you maybe where you're supposed to go or what section you're in, if you don't know where that assignment is, go out to the main office, the main lobby, and there's an information desk. Sorry, we are having an announcement. So at the information desk in the main lobby, you will see people in red jackets or red vests, and they can help you locate where that is. Just show them the assignment sheet with your coordinator's name on it, and they can help locate where exactly you're supposed to be for your shift. If you are driving here, and parking is a premium, and allow time for parking, so it can be very difficult and it can add some time. So you want to allow that so that you're not late reporting to your shift. If you would, what we recommend is that you park over at the Center of Education where you actually were for your interview. That is where the School of Nursing is. And if you do that, you can call the shuttle and they will pick you up. The number for the shuttle is 304-526-1649. And you call that number and just tell them you're at the Center of Education, you need a shuttle, and they will come and pick you up. If you are parking around the medical center and you are choosing the parking garages, you can park anywhere above the second floor. We reserve all the lower levels for our patients and their families. Any parking around the medical center, as well as the Highline Medical Building, all of those flat, the ER, all of that parking is for families and their patients. It's not for students. I will get calls if you're parking there, so please don't park there. So also included in your packet is a map of our campus. I usually explain to people, if you walk into the main lobby and you're standing in the main lobby, and to your right, if you walked as far as you could to the right, that will take you to our outpatient building. That's where we have our ER, that's where we have our outpatient surgery, same-day surgery, and there's some physician's office. So if you think about the far right of the building is services that you come and get taken care of and then leave. If you're standing right in the lobby and the information desk is to your right, the elevators right behind the information desk will take you up, and all of the floors above that are patient care areas. So that's where you're going to find the majority of patients and their rooms. Here on the main level of the hospital is services that you may get for the day or actually get while you're here at the hospital. So we have the surgery department, radiology, lab, so that's all located on the main floor. Of course, we have our gift shop, the cafeteria, our office here, and volunteer services. If you go to the left and go as far as you can, that's considered the west wing. That's where HR is located. The majority of the things located in that building or that tower are office related. There are some patient areas, like pulmonary rehab is in that area, the skilled nursing is in that area, So we have some patient access. Our mother baby unit is on that side, but the majority of that area is business offices. So again, anybody in a red jacket or a red vest can point you, that's their job, and help you find any place that you need in the medical center. Also included in your packet is a designation of security codes. So it is important that you review this, that you look over it, you understand the codes and what they are. As you heard, there was an announcement overhead, so we try to listen to what those are to make sure if there's something that we should be doing. What I want to make note is that there's a couple of them on here that you need to be aware of. So rapid response is sort of our version of a call 911. If you're here in the hospital and all of a sudden somebody collapses in front of you and you need help, your way to get help is calling a rapid response. Doing that is picking up any phone within the medical center and calling 1996. However, when you dial 1996, you are on the hospital-wide intercom system. So it's not like 911 where somebody says, "What's your emergency? How can I help you?" You are just stating that you need someone. So what you would say is you would pick up the phone, dial 1996, and you would say rapid response and identify your location. So if it were happening here in this office, I would say rapid response, volunteer services, rapid response, volunteer services, rapid response, volunteer services. I would say it 3 times. Immediately following me, the operator will then call the rapid response. It's her job to listen to what was said, where the location is, and then a whole team of people that are appointed to that section of the hospital would come to you to assist. Some people who are rapid response patients are actually in a full cardiac arrest, and if you knew that, they had no pulse, they weren't breathing, you would immediately just call a code blue versus a rapid response. Sometimes when that team arrives, they realize that person's non-responsive, and they will pick up the phone and call 1996 and say code blue. So usually, and hopefully, you always have somebody with you in the medical center and somebody else, but if you don't, you need to know how to access getting help rather than running to find help, calling help to arrive to you. So 1996 is overhead, and that is how you get somebody to come and help you. Also review like code red, which is our fire alarm. Listen, oftentimes they'll say code red and they'll identify the location that the fire is. Again, we don't immediately evacuate. In the medical center, we actually have doors that automatically close because they have burn rates through them. You could be in an area that has a door that has a 2-hour burn rate, and they don't want you to evacuate because they're going to contain the fire. So review the codes, understand what they are, and so that when you're hearing them, you'll know kind of your response. Also, in that packet is what we call our pocket reference sheet. So it has a lot of little information. One is our mission statement, which you should always be aware of. We discussed at orientation, our values, and confidentiality. But inside of it also discusses code red as well as operating our fire extinguisher. So code red, let's say there was a fire breaking out, what is my responsibility? And we use the acronym RACE. So RACE is for the R is for rescue. I'm going to rescue anyone that's in immediate danger. A is for activate. I'm going to go activate the fire alarm. So I'm not going to run off and activate the fire alarm if somebody's going to all of a sudden get burned up. I'm going to rescue them first. Then the C is for I'm going to try to contain the fire as much as possible. So I might shut doors. If there's a trash can that's on fire and there's lots of paper around it, I might push that paper out of the way so that it doesn't continue to catch on fire, or I might actually get a fire extinguisher and try to contain it in that manner. And then last, the E is for evacuate. Then we evacuate. If all of those other resources, the R, the A, and the C, do not help us and we have to evacuate, then we evacuate the area. If I'm going to use a fire extinguisher to contain the fire, we use the acronym PASS. So I go and pull the fire extinguisher, and the P is for pull the pin. There's a pin in it, and you pull the pin. The A is for aiming the nozzle, and the S is for squeezing the handle, and then the other S is for sweeping. I sweep that nozzle so that I extinguish the fire. So those are important things for you to know as well. And again, this highlights some of our codes, and it's important that you keep this. This oftentimes, for some of you, you actually probably have a scrub top, and you can put that down in your pocket or put this in the pocket of your pants. We do recommend khakis. You can wear scrub bottoms. I recommend them to be khaki in nature. No jeans, no shorts, no capris, no sandals. I recommend tennis shoes. So, and of course your red jacket, your red shirt with your badge has to be worn at all times. Also on this little packet, I would recommend that you we have some important phone numbers if you need security, if you notice a spill and you need housekeeping to come. These are all extensions. I would put your coordinator's number on here, as well as our door code, the 1245, so that you can remember that. So this is just a quick reference. The other important factor here is your 5 points or moments of hand hygiene. So some of you will not have, if you're watching this video, you are not in a nursing floor. You had to be present to be in that. But we all are responsible for decreasing in the spread of infection. And the number one resource to do that, and the cheapest resource, is hand washing. So you are coming into a facility that has lots of germs, and you're bringing lots of germs. So it's really important that you hand wash. Our 5 points is the idea of, if you take a patient's room, when you come into the room from the outside, you have germs on you. So you want to try to not deliver those to the patient. So you would wash your hands as soon as you came into the room, or you'd use one of the hand sanitizers on the wall. Then if the patient asks you to touch anything in their room, get their bed tray or get their, the remote, then you would get that and then wash your hands again, because now you've touched something in their room that actually might have an infection on it. And then if they wanted you to help them adjust their gown, or you were touching them, or you patted their hand, you would then wash your hand again. So every possible point of contact, and then you will wash your hands when you leave. So you're trying to not bring germs into the room. You're not trying to spread germs from among the room of the items that you touch onto the patient, or from the patient onto those items. And then when you exit the room, you are trying to wash off any germs you might have picked up in the room. So around the medical center, you'll see those sanitizing hand wipes. You need to wash those, use those as frequently as possible, as well as washing your hands, of course, in restrooms, when you go to the restroom, and before you eat. We try our best to keep things clean here, but hand washing is the number one factor that you need to do.
This short video will demonstrate how volunteers sign in and sign out for their shifts. They can also view their service records. There are 3 ways to access the software: the always-on touchscreen in the volunteer office break room, the St. Mary's Computers intranet, and any internet-connected device. If you use the internet or the intranet, you'll be able to clock in or out from your workstation and won't have to go to the volunteer office. Later in this video, I'll describe how to access the software from St. Mary's Computers and the internet. Rest assured, they all operate identically. It starts with a screen with a keypad and a couple of buttons. You start by entering your personal passcode, which for most people is the last 4 digits of your Social Security number. You then verify your name, and you'll see your list of menu options. Here's where you can view your schedule, view your service hours, or sign in or sign out. If you click sign in, you'll see the list of assignments that you qualify for. Click the one that you're signing into and your time will be recorded. If there's a personal message for you in the system, it will then be displayed. Go ahead and read it and click continue. And you're signed in for your shift. Now, signing out is very simple. You input your personal passcode, verify your name, and click sign out. Now I'll demonstrate how to access the program from St. Mary's intranet. From almost any St. Mary's computer, open a browser and the intranet. This page will be displayed. If you have trouble locating this page, ask one of the hospital staff. They all use this on a regular basis. Click the tab on the top right called Departments. Then click Volunteers. That'll pull up the volunteer portal. And voila, you're in. Once here, you can save this page as a favorite or a bookmark in your browser. So all you have to do is click this bookmark or favorite and it'll open right to this page. To access the software from the internet, log on to any computer that has internet access or your smartphone, go to stmarys.org, hover over Centers and Services, move to Volunteer Services, and click the Volunteer Portal. And voila, you're in. And just like the intranet, you can save this as a bookmark or a favorite and have one-click access. Now the final item I'm going to demonstrate is how to add a button to your smartphone or tablet so you can have one-click access straight to the sign-in page. And once there, you can pinch the screen to make the buttons larger for easier access. This is not a difficult process. If you're using an iPhone, you can simply ask Siri to take you to St. Mary's Medical Center, or you can do it manually by accessing Safari and typing in St. Mary's Medical Center. If you're using an Android, you can either use the Google Assistant or access the internet through Google, Chrome, Firefox, or whatever browser you have installed. No matter how you normally access the internet, the important thing is you simply get to St. Mary's Medical Center's website. And once you get there, you simply click the top button, Centers and Services. You then scroll down very near the bottom. Third thing from the bottom is Volunteer Services. And this page should look familiar. Scroll to the bottom and you'll see the volunteer portal for current volunteers. And there you have it. To save this, click the ellipse on the top right corner and click Add to Home Screen. And then click Add. Don't modify the URL. Then go to your home screen, and somewhere you'll find a new button. And there it is. Click it and it'll open right to this login page.